secondly, is how I look at a case, what my approach is. In other words, do you have a method to dismantle a case so that within a matter of seconds you can go through a checklist and you can read a case knowing exactly what you're looking for and not waste your time looking for things that are not important. So that if your colleague stood next to you, an orthopedic surgeon for instance, and asked you to go over a case, you can't say, well, excuse me, I'm going to go to my office for 5 minutes and I'm going to look at this case and I'm going to come back and we'll go over it together. You can't do that. And oftentimes in high-profile cases, if you have a professional athlete, they'll have their nutritionist, their psychologist, their sports agent, their orthopedic surgeon. They'll have this whole entourage with them. And they're standing behind you asking you what you think about the case. And you have about, I would say, maybe 5 or 6 seconds, and you got to start talking. And so if you don't talk in 5 or 6 seconds, they're going to assume you don't know what you're talking about. So that means within 5 seconds, you sort of have to have a method that gives you enough confidence that you know what's wrong with the case, and then as you're talking, you can go through the rest of the case. So how you look at a case, how you read each of the joints that we're going to go through, that's the most important thing that you can take away. All the academic information that I'm going to give you, and it's a lot, is also important, but not as important as can you systematically go through a case more efficiently and faster than anyone else. And the other thing I want to emphasize is the style, the manner in which you express yourself in a written report and verbally too. So before I start the shoulder section, I have these little short lectures that I want to talk to about how to dictate a case. Because when I teach fellows how to look at a case, I always say don't use words like appears, or don't use words like I'm thinking of, or don't use words like I'm wondering if, or don't use words like probable. And sometimes you'll see in one sentence, you'll see them all. They'll say,